CPR 2026 Bystander CPR, Good Samaritan Laws and Certification Guide. All you need to know. Question 1. What is the correct compression rate for adult CPR? 60 to 80 per minute, 80 to 100 per minute, 100 to 120 per minute, 140 to 160 per minute. High-quality CPR requires a rate of 100 to 120 compressions per minute. Question 2. How deep should you compress the chest during adult CPR? At least 1 inch, at least 2 inches, exactly 3 inches, 4 inches. For adults, compressions should be at least 2 inches, 5 centimeters, deep. Question 3. What is the first step in using an AED? Apply the pads, turn it on, press the shock button, clear the victim. The very first step is to turn the device on so it can provide voice prompts. Question 4. When performing hands-only CPR, what is the sequence? Compressions only, breaths only, 30 compressions then 2 breaths, 15 compressions then 1 breath. Hands-only CPR involves continuous chest compressions without rescue breaths. Question 5. What does the Good Samaritan law generally protect bystanders from? All lawsuits, legal liability when providing care in good faith, traffic tickets, medical bills. These laws encourage people to help by providing limited legal protection. Question 6. If a person is choking and can cough forcefully, what should you do? Perform the Heimlich maneuver. Encourage them to keep coughing. Give them water. Slap them on the back. If they can cough, the airway is only partially blocked. Do not interfere. Question 7. What are the signs of a heart attack? Chest pain, shortness of breath, nausea, headache and fever, itching and rash, hunger and thirst. Typical signs include chest discomfort, pressure, and radiating pain. Question 8. A victim is unresponsive and not breathing. You should wait for a doctor, call 911 and start CPR. Check for a pulse for 2 minutes. Give them some water. Immediate action, EMS and CPR, is vital for survival. Question 9. What is the correct ratio for CPR with breaths on an adult, 1 rescuer? 15:2, 30:2, 5:1, 50:2. The standard ratio is 30 compressions to 2 rescue breaths. Question 10. Where should you place your hands for chest compressions on an adult? The upper chest, the lower half of the breastbone, sternum, the left side over the heart, the stomach. The center of the chest on the lower half of the sternum is the correct location. Question 11. Why is it important to allow the chest to recoil between compressions? To rest the rescuer, to allow the heart to refill with blood, to check if the victim is awake, to prevent broken ribs. Full recoil ensures maximum blood flow during the next compression. Question 12. If the AED says no shock advised, what should you do? Turn it off. Immediately resume CPR. Wait for the ambulance. Check the pads. If no shock is needed, continue CPR starting with compressions. Question 13. What is the acronym FAST used for? Heart attack, stroke, choking, bleeding. FAST stands for face, arms, speech, and time, for stroke identification. Question 14. What should you do for a victim of a severe opioid overdose? Administer naloxone, Narcan. Give them coffee. Make them walk. Put them in a cold shower. Naloxone is the reversal agent for opioid-induced respiratory depression. Question 15. How should you help an infant who is choking, responsive? 5 back slaps and 5 chest thrusts. Abdominal thrusts, Heimlich. Blind finger sweep. Wait for them to stop crying. Infants require back slaps and chest thrusts, not abdominal thrusts. Question 16. When should you stop performing CPR? When you are tired. When the scene becomes unsafe. When an AED or EMS arrives. Both B and C. CPR continues until the victim revives, EMS takes over, the AED is used, or the scene is unsafe. Question 17. Can you use an AED on a victim who is lying in a puddle of water? Yes, always. No, move them to a dry area first. Only if they are wearing a wetsuit. Yes, but only the adult pads. Water conducts electricity. The chest should be dry and the victim moved from standing water. Question 18. If a person is having a seizure, your main priority is putting a spoon in their mouth, restraining their arms, protecting them from injury and timing the seizure, performing CPR. Protect the head and clear the area. Do not restrain or put objects in the mouth. Question 19. Bystander CPR can ________ a victim's chance of survival, double or triple, decrease, have no effect on, slow down. Early intervention is the most critical factor in out-of-hospital cardiac arrest. Question 20. What is the purpose of rescue breaths? To pump blood, to provide oxygen to the lungs, to wake the person up, to check for a pulse. Breaths deliver oxygen when the victim's own breathing has stopped.